Good morning. Today I'd like to discuss about the urinary system. It's very much important. It's very much important and vital system in our human being. Remember this one. First of all, you have to know the anatomy, physiology, pathology, immunology of the renal system. You should know this one. Otherwise, you cannot understand the disease. Remember this. Kidney. First of all, kidney. It is one vital organ. It has got two parts. One is cortex and medulla. In cortex, have juxtaglobulus apparatus and medulla containing collecting duct tubule and lympho family. Remember this. Next, you should know what is nephron. It's very much important parts of the kidney. What is nephron? It is a structural and functional units of the kidney. It has got two parts, renal corpuscle and renal tubule. Renal corpuscle means glomeruli and Bowman capsule. Then tubule means tubules, ascending limb, descending limb, loops of Henle, collecting duct. These all are tubules. Now, how the urine is formed? Urine is formed by the first of filtration, then secretion, then reabsorption. And each minute 1 ml urine is formed. Remember this. And glomerular filtration is 125 ml per minute. Remember this. 125 ml per minute is formed. But urine form only 1 ml per minute. Remember this one. Now, I discuss about the what is glomeruli. It's very much important thing you should know. What is glomeruli? It is a tough capillary bed. It is a tough capillary bed having afferent and efferent arterioles, and it is high pressure capillary bed. It is only the specialized vessels in our body who have 3 layers capillary bed. It has got 3 layers capillary bed. From inner to outwards, endothelial layer, the glomerular basement membrane, then epithelial layer. In endothelial layer, there is a numerous penetration, and glomerular basement membrane is composed by glycoprotein, and epithelial lining is composed by filtration slit, filtration diaphragm, and processed food process. Remember this one. All the diseases happen in the glomeruli. Remember this one. Now, I like to. And also there is other specials, another 2 capillaries. One is glomerular capillaries, another one is peritubular capillaries. I told you glomerular capillaries is a specialized capillaries. It is arterial end, but peritubular capillary is a venous end, and glomerular capillary is a high pressure capillary bed. It is about 60 millimeter of mercury pressure, but peritubular capillary is only 13 millimeter of mercury pressure. The function of the glomerular is filtration, but function of the peritubular capillary is reabsorption. Remember this one. Next, you should remember this. What is now? I discuss the disease about acute glomerulonephritis. Acute glomerulonephritis means inflammation of the nephron. Inflammation of the glomeruli is called the glomerulonephritis. Remember this one. Now, how it classified? It's 2 types. One is primary glomerulonephritis, another one is secondary nephritis. Primary glomerulonephritis, it may happen due to immune-mediated cause, then some infectious cause, then some genetic cause. But secondary glomerulonephritis is some systemic diseases. It is due to some systemic diseases like SLE, Helicobacter purpura, malarial plasmodium pallidum infection. These are all of the difference between the primary glomerulonephritis and secondary nephritis. Remember this one. Now the acute glomerulonephritis, how the patient is present to you. How the patient is present to you. First of all, the age of the patient is 5 to 12 years age. 5 to 12 years age. And there is a acute nephritic syndrome. Acute nephritic syndrome means gross hematuria, hypertension, acute renal insufficiency, and edema. And there is some abdominal pain, nausea, vomiting, headache, vertigo, vertigo, and convulsion. These are the clinical manifestation of the acute glomerulonephritis. You should remember this one. This is the clinical manifestation. Then how are the investigation? How we investigate? First of all, urine analysis. Urine, you show look the urine RBC cast and proteinuria. RBC and RBC cast is the hallmark of the disease. Remember this. Then CBC. In CBC, what will happen? that is polymorphonuclear leukocytosis and normocytic normochromic anemia, and complement 3 will be low. The complement 3 will be lost, and there is evidence of the strocococcal infection. Evidence of the strocococcal infection means there is a throat swab culture, positive throat swab culture, positive estrogen test, so titer will be rising, and anti-DNSB also positive. Remember these are the investigation. Now the treatment plan. What the treatment plan? Treatment just supportive treatment. Treatment is just supportive treatment. Just supportive treatment. Supportive treatment. What the supportive treatment given? There is a fluid restriction, salt restriction, potassium content diet restriction, and maintain the renal chart. Remember this one. Then 10 days penicillin, that phenytomethyl penicillin. 10 days penicillin, that is phenytomethyl penicillin 10 days should be given for prevention of the community spreading. Remember this one. Then the treatment of hypertension, you should given the antihypertensive, the nifedipine, ACE inhibitors, these are the treatment should be given for antihypertension. And sometimes we also given the diuretics. The severe edema, they are given the diuretics. Remember this one. This is a symptomatic treatment, just symptomatic treatment. Now the another one is treatment of the complication. What is the treatment of the complication? First of all, due to hypertension, what will happen? Due to hypertension, what will happen? Hypertensive encephalopathy, acute left ventricular failure, acute renal failure, acid-base imbalance, then dyselectrolytemia. This is the complication, treatment of the complication. First of all, I told you there is a hypertensive encephalopathy. What is the treatment of hypertensive encephalopathy? Treatment is hypertensive encephalopathy. First of all, control the feet by parenteral diazepam and phenobarbital should be given. This is the treatment of the encephalopathy. Then what is the treatment of the acute heart failure, acute left ventricular failure? Immediate hospitalization, for position oxygenation, then diuretics and digitalization should be done for acute left ventricular failure. Next complication is acute renal failure. Due to acute renal failure, treatment modality is just dialysis. Remember this, dialysis will be the treatment of acute renal failure. Then acid-base imbalance, that is metabolic acidosis. This metabolic acidosis should be treated by 7.5% sodium by carbs 1 to 2 ml per kg of the body given for acid-base imbalance. Next is due to the electrolyte imbalance. The hyperkalemia is very much important one is hyperkalemia. The treatment of the hyperkalemia is first of all given the 10% calcium gluconate, 2 to 3 ml per kg of the calcium gluconate should be given. Then given sodium 7.5% sodium by carbs should be given. Then given insulin and glucose and insulin. Glucose and insulin should be given for the treatment of the hyperkalemia. Next, that is sodium K-oxalate. It is one regime. Sodium K-oxalate is one regime food given orally or for rectal area of this one. This is all the treatment of the complication. Now, what the prognosis? Prognosis is very much. Complete recovery is more than 95%. Remember this. Complete recovery more than 95%. Few of the patient is died due to complication, and few of the patient is developed chronic renal disease, and recurrent are extremely rare. Remember this. Thank you very much. Thank you very much for patient hearing.